Hi, my name is Dr. Adam Arnofsky. I'm the Chief of Cardiothoracic Surgery here at Englewood Health. My specialty is adult cardiac surgery. I've focused on that pretty much for the last 10 years since I've been here. I do all open heart surgeries on adult patients. And the past 6 or 7 years, I've also included into my kind of repertoire some structural heart disease. So one of the newer things we do here is procedures that are avoiding open heart surgery to fix patients' valves. The open heart procedures that we perform here, it's a long list, but we include bypass surgery. So if you know someone who've had a quadruple bypass, that's what I'm referring to. We do open valve surgery, aortic valve surgery, mitral valve surgery, repairs of the mitral valve and replacements of the mitral valve. And then some other things like open aortic surgery. Frequently have emergency operations, patients who come in with issues through the emergency room that we have to deal with right away. We take care of those as well. So structural heart is a new kind of subfield within heart surgery, within cardiology. It's been a great addition to the program here over the past 6 or 7 years, where the surgeons and the cardiologists work side by side using some newer techniques to repair structural issues with the patient's heart. So we can plug holes, we can fix valves, we can replace valves, all with avoiding open incisions. It's a great feeling. I live and work in the same community. So for me, I didn't even think this would ever come into play, but it's very, very rewarding to be out and about in the neighborhood and bump into somebody who I've operated on. And they grab me in the pizza place, "Oh, Doc, I'm feeling great." It is a great feeling to be able to help out your neighbors and your community members to live their lives feeling better, living longer, hopefully getting back to their great level of activity.